Being able to document a timeout prior to performing a procedure is important. It is also important to know what to do when an issue arises during a timeout. If during a timeout, anyone involved notices an issue with any information, such as information not matching, missing documentation or results, or anything that just doesn't seem right, that person needs to have the knowledge and confidence to speak up. Announce that the timeout must be paused, and that everyone needs to work to resolve this issue before continuing. That's why timeouts are a part of our practice. We are trying to identify anything that could lead to harm or injury to the patient. And if we can't speak up when we see it, we shouldn't be a part of the process. You are about to watch a series of videos demonstrating the timeout process that will showcase how to identify and resolve issues during a timeout. Some videos will be shown in color while others will be black and white. A full color video represents the correct way to perform a timeout and to deal with issues. Black and white videos represent errors and issues. As you watch these clips, pay attention. You will be required to answer questions regarding what was just viewed before being able to continue to the next clip. Hello, I need a nurse here. We're going to place a chest tube in this patient.
I'm the nurse for this room. I wasn't aware of any procedure scheduled today.
Well, we're going to need to do it right now, so I need a kit in the room ASAP, and I will meet you in there.
Okay, be right there.
Here is an example of how this process should work. Hello, I'm planning to do a chest tube placement in room 3114 at 12:30.
Yes, I saw the order that you placed. I have the supplies ready, and I was just about to go over the pre-procedure checklist.
Excellent. I just finished reviewing the pre-procedure checklist as well, but we still need to get consent signed and mark the site. Would you be able to accompany me into the room to finish those up before we do the timeout?
Yes, of course.
Now let's go back to continue our less than perfect example. So I need a kit in the room ASAP, and I will meet you in there.
Okay, be right there.
Okay, let's get the supplies set up here, and we can get started.
Doctor, we need to perform a timeout prior to initiating this procedure.
Well, then I don't think I have time to place this right now, so let's do the timeout, and then I'll need to leave, but my partner should be along soon, and you guys can do the procedure together.
Timeout.
It's not uncommon for physicians and nurses to be in a bit of a rush. Having to take time out of the day to perform a procedure can throw off your schedule, and that can lead to the practitioner focusing on the task at hand. We need to finish this procedure so I can continue with X, Y, and Z. With such focus on the procedure, things could be missed, like the timeout. Regardless of any reason for the mistakes, everyone in the procedure should feel confident to vocalize, in a respectful way, that a timeout must be completed, and completed in the correct way.
Actually, we can't do a timeout unless everyone participating in the procedure is present, and it needs to be done right before the procedure, so we know that nothing could have changed in the time since the timeout. So we can either do the timeout and the procedure right now, or I could have everything ready to do the timeout and procedure with your partner when he arrives. What would you prefer?
You're right. Thank you. Let me clear my schedule and we can get this done right now.
Okay, sure.
That was great, but things are about to go wrong again. Watch the following timeout and identify the issues that should be addressed. You will be asked questions about what you viewed once the video is completed. Hello, Mr. Glass. I'm Doctor and this is Nurse, and we're going to be inserting a chest tube to help you breathe. We do have to check a few things first, though. Before we start, do you have any questions about this procedure today?
No, I don't have any questions.
Can I have you start by stating your name and date of birth?
George Glass, November 20th, 1970.
I have George Glass, November 20th, 1970, match.
And I have George Glass, November 20th, 1970, and that is a match.
Do you agree we have the correct patient?
Yes, I agree.
Do we have the correct site? This is listed as a left chest tube placement.
Yes, this is a left chest tube placement. And I will mark the site.
Is the patient in the correct position?
Yes, the patient is in the correct position.
Mr. Glass, what is your understanding of the procedure?
You're going to put a chest tube in my left side.
Do we agree that this is the correct procedure?
Yes, this is a left chest tube placement.
Mr. Glass, can you please state your allergies?
Yes, I'm allergic to penicillin.
I have penicillin as the only medication allergy.
Yes, penicillin is listed as an allergy.
Were antibiotics ordered and given to the patient?
Yes, cefazolin 2 grams was ordered this morning.
The MAR shows that cefazolin 2 grams was administered. Do we agree that the antibiotics were administered?
Yes, we agree.
Is the consent form signed? I have a consent form here showing Mr. Glass's signature.
Yes, I also see Mr. Glass sign this consent. Mr. Glass, is this your signature on this form?
Yes, that's my signature.
Were the radiology studies reviewed?
Yes, this chest x-ray shows a left pneumothorax.
Were the lab studies reviewed from today?
Yes, labs are reviewed and there are no issues with any labs or anticoagulants.
Are all safety precautions and procedures reviewed?
Yes, safety precautions have been reviewed, followed, and completed. I think we're ready to go here.
Great.
The first issue we saw with this timeout came when the flow sheet prompted to identify the correct site was marked. The nurse and doctor verbalized that this was a left chest tube placement, but then the doctor proceeded to mark the patient's right chest. There are really two issues here. The site should have been marked prior to starting the timeout. Then, they would have been verifying that the correct site was marked, and not actively marking it right now. The second issue is that the wrong site is being marked. Now, despite the fact that they verbalized and validated the correct site, if they place the tube based on the patient marking, that tube will be in the wrong location and potentially cause life-threatening harm to this patient. If the nurse, physician, or even the patient had caught this error at any time, the timeout should have been paused and the issue resolved before continuing. The second area of concern occurred when the timeout flow sheet directed the practitioners to review the consent. The nurse pulled out the only consent on the chart, which was a general consent for treatment. It was appropriately filled out, but general consents don't cover the requirements for many invasive procedures. Any procedure that requires a timeout also requires a procedural consent be filled out for that specific procedure and signed. At least one of the two practitioners involved should have noticed this issue, and when it is identified, the timeout needs to be paused until the issues with consent can be resolved. If you question if a procedure requires informed consent, a list of many of the most common procedures that do require informed consent can be found in the Informed Consent policy. This is how these issues should have been identified and addressed. And I will mark the site.
Doctor, we need to pause the timeout. The order states that this is a left-sided chest tube placement. Can you please verify before marking the site?
Absolutely.
You were about to mark the patient's right side, but the order here says left, and we had verbalized left-sided placement. Here's the chest x-ray. We should verify the correct site before we continue.
Great catch. Let's double-check everything before moving on. That was a great catch, but the need for it could have been avoided if the doctor had marked the site during the pre-procedure verification process. There should be no need to mark the site during the timeout because it should have been completed prior to the timeout. And when that's the case, you would be verifying that it was marked correctly, instead of marking based on a previous verbal verification. This issue can likely be addressed and resolved at the bedside, and if this is the case, once it is resolved, the timeout can continue where it left off. However, if anyone must leave the room before resolving an issue, the timeout should be restarted from the beginning once everyone is present in the room. You want to avoid the risk of anything having changed with the patient, or from something being missed due to confusion as personnel are coming and going from a room, or from too much time having passed since the beginning of the timeout, which is likely to be the case when anyone has to leave the room. Next, let's take a look at how to best resolve the issues with consent.
Is consent signed? I have the consent right here. Doctor, we need to pause. The consent I have here is a general consent for treatment, but I don't see a procedural consent for this chest tube placement.
You're right. I thought I got consent earlier, but I don't see it here either. I'm sorry. Let me deal with this, and then we can restart this timeout.
Sure, let me know when you're ready.
In this case, the doctor would need to leave the room, fill out a procedural consent for this patient, come back in, explain the procedure, and ensure that the patient is well informed, and obtain a signature. This will take a significant amount of time, and would necessitate restarting the timeout from the beginning once consent is signed. Consent is also something that should be completed and checked during pre-procedure verification. While obtaining consent from the patient and explaining the procedure, the physician should also be marking the site. The pre-procedure verification is very important. If everything is roughly reviewed and sorted out before the official timeout is started, the timeout is a simple, quick, and effective procedure that ensures the health and safety of the patient. When it is not completed properly or skipped entirely, you encounter issues such as those demonstrated here. It is so important that everyone involved in a timeout not only understand the process, but the importance of it. Know that when you speak up to identify an issue, you are doing it to keep the patient safe. Have confidence, because that confidence could save a life.